All right. Hi, I'm Catharine Wang. I'm a professor in the Community Health Sciences Department here at BU. And a lot of my work that I'm going to talk about today is really thinking about population-based efforts to facilitate access to genetic cancer information and services. We're really looking at sort of the translation of our understanding of genes, especially in the as it predisposes individuals to cancer, and really thinking about genetic testing in particular and increasing access to these services. So we know that there's a lack of access, and we know that facilitators and barriers are often sort of articulated and well known, except that a lot of research that we're doing right now is really trying to sort of understand really the variation at the systems level and the contextual factors that are less well understood. So a lot of our work is really thinking about solutions and multi-level solutions to address some of the concerns that we've seen about access to care in this sort of effort, looking at genetic testing and thinking about the types of studies that have been conducted to date and how we can sort of add to our existing understanding and thinking about solutions. And so a lot of my work as an interventionist and as an implementation scientist as well is thinking about identifying and addressing barriers. And so much of what we've done to date is really in the realm of two buckets. One is digital solutions. And so there's two studies here that I show. One is a sort of conversational agent that we worked on with several colleagues here at BMC and Northeastern, looking at conversational agents and whether or not they can sort of engage with patient populations who may have low literacy to really complete family health history information to ascertain risk. And this is something that we did in a randomized trial where we were able to demonstrate that the conversational agent works better than traditional web-based platforms to facilitate the collection of this information and generate risk algorithms and identify people who are at risk that can then be sort of funneled into different types of care. Another study that we're doing is with the Black Women's Health Study, and this is where we took the opportunity to look at the genetics research that's being done within that cohort and to return results that we're doing in a non-inferiority trial, testing sort of traditional genetic counseling results returned versus an online platform. We also looked at system solutions here, and we're studying sort of workflows and looking at the workflow impact on engaging in genetic counseling and testing. And we've demonstrated that point of care or mainstream type workflows do make a big difference in terms of access to care and mitigating disparities that we've seen in traditional workflows like referral models and even point of care scheduling models. And we've also done a cluster randomized trial looking at 12 primary care clinics, looking at different engagement models to look at whether or not how we approach patients and how we engage with them leads to different downstream outcomes in terms of risk assessment and testing, and looking at evidence of selection bias and issues in terms of how we approach and engage with patient populations. Finally, I just want to talk about some other areas. A lot of our work is really looking at multi-level influences and understanding hereditary cancer care delivery. We're also looking at population-based genomic screening and primary care settings and really focusing on a community engagement component. I also wear the hat as an associate director of community engagement here at BU CTSI. So for those of you who are really interested in community engaged research, let's talk. We are definitely looking at developing strategies to facilitate greater engagement and partnerships between academics and folks at the community hospitals here within the Boston area. And we run the Boston Health Research Collaborative, so I'm happy to talk to folks about that. And I also wear the hat as an evaluation lead and looking at the Equity in Cancer initiative here at Boston Medical and looking at and facilitating the evaluation of ongoing efforts in terms of screening for our patient populations here. So if there's any interest in that, happy to talk. Thank you.